Well, joining me now in the studio to talk more about this is Dr. Volker Budach. He heads the Department of Radiation Oncology at the Charité Hospital here in Berlin. Thank you for being with us today, Dr. Budach. Now, heavy ion therapy worked for the patient in that last report, but how optimistic are you about this treatment for tumors?
Protons and heavy ions have physical properties which put them into a favorite role for the treatment of cancer patients in the future, especially because they can be stopped right after a tumor and within several millimeters can be come down from 100% to 0%. So the burden of radiation to normal tissue can be considerably spared.
Okay, and what about side effects?
Side effects should be about in the range as with conventional radiation, except for secondary tumors, where we expect more secondary tumors in conventional radiation therapy than for this kind of irradiation.
Right. What kinds of cancers are best treated with ion beams?
Mainly, these should be children, tumors in children, because of the secondary neoplasms, as I already mentioned. And then, of course, tumors which are in the direct vicinity of very radiosensitive structures, like, for instance, the optic nerves or small bowel or spinal cord.
All right. And what has been your personal experience with particle beam therapies?
Particle beam therapies have been done in my career when I was still in Essen University, and we had there a neutron facility for neutron irradiation, which is a heavy particle, and which was, of course, not so focused like today.
All right, now this treatment is not for everyone. It's not available everywhere in the world, and it's very costly. That machine costs up to 200 million euros. So would you then say it's a realistic method for cancer patients?
Yes, it might be in the future when we have, or we will have, compact machines, which are much smaller. They have not treatment rooms like in these huge machine facilities of 4 or 5, but only 1. And this can be built up in every large clinic or university unit, and then treat about 400 or 500 patients a year.
Now, how does ion beam therapy compare with other forms of radiation?
It should, principally, it should have some advantages, but there are no proofs until now that it really works better than photons or the normal conventional radiotherapy. Therefore, we are doing in the future lots of clinical trials to, at the end, rule out what is best or not.
Okay, and speaking of the future, what is the future of cancer treatments then?
I think it's a local treatment, optimization of a local treatment in local tumors, and as soon as they are disseminated, you need, of course, systemic treatments.
Okay, Dr. Budach, it has been very interesting having this discussion with you today. Thank you for being with us.